Hello, I am Dr. Dhananjay Chauhan, dermatologist and hair transplant surgeon, Hair MD and Clear Skin Pune. Dear friends, today we are going to discuss about derma roller or microneedling, which is helpful treatment modality while treating hair loss or male or female pattern alopecia or androgenetic alopecia. Hair loss is common in every age, and patients are taking treatment for this with various expectations. Mainly in alopecia or hair loss, male pattern or female pattern hair loss, patient's expectation is to maintain what is there. Whatever hair are there, they want to maintain that. Second important thing, what they want new hair growth on their scalp. Wherever they are feeling their hair has lost, they want new hair growth. And they want improved thickness of their hair and density should be improved. This much expectation they keep, or every patient keeps. Whether it is possible, yes, with the help of whatever traditional treatment modalities we are using in the sense finasteride and minoxidil, which is traditionally used to control androgenetic alopecia or male pattern, female pattern baldness. These treatment modalities, they are useful only in 40 to 60% of patient. Remaining patient do not respond to this traditional line of treatment or do not fulfill whatever expectations patients are having. Why it is occurring? Yes, when we go to the pathogenesis of hair loss or alopecia or MPHL or female pattern baldness, it is found that it is multifactorial. Exact etiology is not known. It is multifactorial gene, then genetic tendency not only, but hormones, inflammation, various types of deficiencies of growth factors. New hairs are not properly formed, thinning is occurring, stress, nutritional deficiency, lifestyle, pollution, everything is contributing to the hair loss or this pattern baldness. So not a single treatment, that means only finasteride or minoxidil, is able to control all these treatment. With this treatment, able to control the hair loss. That's why, along with this traditional treatment, there are various supportive treatments which are there, and out of that, important treatment modalities, it is platelet rich plasma or PRP, microneedling or derma roller, low level laser light therapy is there, mesotherapy is there. These are the few to name. Today, we are going to see how derma roller is supporting or augmenting traditional line of treatment, or how it is going to give response or supportive treatment modality for traditional line of treatment. In today's video, we are going to see how derma roller is done, why it is done, are there any scientific proofs or scientific studies to support this, whether it is useful, how much it is useful, why it is useful, and when you can do and when you cannot do. We'll see all these things in detail. In nutshell, if you want, you can use this supportive treatment, microneedling or derma roller, to support your traditional line of treatment with finasteride, minoxidil, or whatever your treating doctor suggests. It is useful. It is useful. But what next we are going to see is why we are using this, and why you should concentrate, and why you should do it under supervision of your treating doctor or your treating dermatologist or hair specialist who suggest you to go for derma roll. It is not 100% FDA approved treatment modalities, but it is evidence based, scientific. Lot of research is going on this, and this research shows that this is useful. Our Indian doctors and Indian researchers, scientists, those have published lot of papers on this, and it is finding very much supportive to a routine line of treatment. Around 40 to 60% patient they respond to finasteride and minoxidil, but remaining don't respond. In such patient, how this is useful? First, we will see how derma roller might be acting to support the treatment. How it is acting? Derma roller in this very simple procedure. First, we will see how it is done. It is very simple procedure. Derma roller, multiple stainless steel, medical grade stainless steel needles are put on a roller, and those roller they are rolled on the skin surface. We are using on scalp, so we use it on scalp skin, and epidermal minor traumas are done. These minor traumas are the main reason why it is useful in giving or stimulating hair growth or making hair strong. How it is happening? After doing derma roller, there are minor injuries, minor micro channels are formed, and through this minor injury, when skin starts healing, at that time a lot of growth factors comes there, platelet comes in that area, and all these things, this cascade, wound healing cascade, it what it does, it brings their growth factors, it starts stimulating newer vascularization, or new capillaries are formed in that area, blood flow to that area increases. And important thing, with this derma roller, whenever wound healing starts, at that time we can see stimulation of various stem cells which are present on the hair bulb and bulge area. Those stem cells are stimulated, and these stem cells try to form new hair, those hairs which are in dormant stage, those hairs which are in continuously in long-term telogen phase, those hairs are stimulated. Or those hairs which are very thin, villous, or which are not growing, to them also with this derma roller, improved vascularization, excess growth factor comes there, or stimulation of bulge and bulb stem cell, it starts growing those villous hair, thin hair, and slowly those villous and thin hair comes out, and those thin hair, villous hair become thick, and then they become terminal hair. This thing can occur, and that's why you are saying with the help of derma roller, many hair grows, density starts improving, hair thickness starts improving, and hair loss usually gets controlled. So along with traditional line of treatment, whenever we do treatment with derma roller, then surely you will see the improvement, and you can augment the effects of traditional line of treatment. So with the help of derma roller, there is stimulation of newer hair growth, improved thickness of hair, and it is supportive treatment to the routine or traditional line of treatment. This thing is important. Then how it is done? Already I have shown you. I will show you the instrument. This is derma roller. This is having this rolls over the skin of the scalp, and these are the medical grade stainless steel needles, and this is rolled over the scalp. Especially if you want better result, then you have to get it done in systematic way at the dermatologist or your treating doctor's clinic. If it is done under supervision of doctor, then it is really good and really helpful, because in doctor's clinic more than 1.5 to up to 2.5 millimeters derma roller they are used. But when you do at home, or when it is given for home treatment, then only 0.25 2.5 millimeter derma rollers are given to you. Those are not that much useful or that much good to stimulate the hair growth. So this to get derma roller done, what precautions you should do? You should have hair which are trimmed very thin. Otherwise, hair may tangle in this roller while rolling. Rolling should be done in all four direction, or it is done in star shape fashion. It is done. There are different types of protocols which are used by different clinics. Usually what protocol we follow, it is every weekly for 1 month we do, and then every 15 days for another 2 months do, and then every month we do for another 3 to 6 months. So with this, very good results are there. And while doing derma roller, we take precaution that those patients who are having scalp folliculitis, we do not do. Those patients who are much sensitive for pain, usually there is no pain, it is bearable uneasiness on the scalp. If those patients who are too much pain sensitive, then we try to avoid these derma roller, or we give them 0.25 to 0.5 millimeter derma roller. So such a novel, non-surgical, non-invasive, very simple procedure gives you a supportive treatment modalities to treat your hair loss, especially pattern hair loss, and it is one of the important treatment modalities and highly demanding treatment modalities in case of hair loss or alopecia. One more thing about this, all these treatment modalities, they are supportive, because exact pathogenesis and exact etiology of pattern baldness or female and male pattern hair loss, it is not known. It is complex. Still, there is no single drug or single treatment modality which can give you 100% best. Another important thing, when there is grade 6, grade 7, or when there is slick baldness, no treatment can regenerate your hair back, or they will not become thick, dense, or no new hair will come. Once hair becomes totally slick, baldness is there, there are no hair, then no treatment can stimulate hair again. So it is better to treat it when there are hair loss, but few hairs are present on your scalp, especially grade 2, grade 3, grade 4, up to grade 5. You can treat it and you can regrow hair with the help of traditional treatment modalities and supportive treatment modalities like derma roller. Derma roller can be combined with any other treatment modality which is available, especially it can be combined with PRP, mesotherapy, or low level laser light. This treatment modality can be combined. So it is one of the simple and effective treatment modality you can do under supervision of your doctor, and then you can do it at your home also. So if your doctor suggests, try to do it, because it will give you best possible result which are available. You do it, do under supervision of your doctor. After knowing that your hair loss is pattern hair loss, androgenetic hair loss, then you can do safely with the guidance of your dermatologist. I think I have tried to clear majority of doubts about use of derma roller. Still, if you got any type of difficulty or any query, you can ask us below this video link. You can ask us, or you can go to our website, or you can ask us on given mail also. Uh, Second important thing, whenever or whosoever of your known, your friend or any family friend, if they are suffering from hair loss, you can share this educational channels link to your friend and your relative also. If you like, you can comment it, and all the best for treating your hair loss. Thank you. Thank you very much.